Good day everyone, my name is Jella Ferculation, and for today I'm going to perform nasogastric and orogastric tube feeding. But first, we need to define the terms. What is a nutrition? So nutrition is a process of providing and obtaining food necessary for health and growth. Next is, what is a malnutrition? So a malnutrition is a lack of proper nutrition caused by not having enough food to eat and by not eating the right food with the right nutrition. Next is, what is an enteral nutrition? So an enteral nutrition is a delivery of nutrients beyond esophagus via feeding tubes placed into the stomach or intestines of a human or the patient. Next is a nasogastric tube. So a nasogastric tube is a special tube that is used to carry liquid with foods and medicine to take it to our stomach or intestines via the nose. And now let's proceed to the orogastric tube. So the orogastric tube is a tube that is inserted to the patient's mouth, not in the patient's nose. So it is used for medical administration, for feeding, and for removing the air of the baby in their stomach. And now let's proceed to the purpose of the procedure. So first is that to remove gastric secretions, and the next is to provide food or medications to the child whenever they can't swallow. And lastly, to have an access to the stomach and to check the contents inside of it. And now let's proceed to the materials needed for the demonstration. Okay, so for the materials needed for this procedure, we need to have an ethyl alcohol, a towel, a surgical gloves, a lubricating jelly, a pen light, a medical tape, sterile water, 30 ml syringe, liquid medication, the liquid feeding for the patient, a water, tap water, wet cotton balls, my DIY feeding bag, NG tube, the nasogastric tube, and then our administration set. Next is the stethoscope, and lastly the pH indicator strip. So now that we have all the materials needed, now let's proceed to the procedure. And my DIY IV pool, the black one. So now let's proceed to the assessment. So first is that we need to review the patient's medical history because we need to know the medical conditions that may cause the loss of his GOG reflex. So the rationale of that is to prevent complications and then to provide accuracy, prevent errors and further complications during the procedure. Now, next is we need to check for the patency of the nares and the intactness of the nasal tissue. We also need to check for the history of nasal surgeries and deviated septum. So the rationale of that is to check any signs of nostril infection and to prevent complication. And then next is we need to determine the presence of GOG reflex. So the rationale of that is to help for intubation decisions. Next is we need to assess the mental ability, the mental status, and the ability to understand of the patient. So the rationale of that is to check if the patient is unable to easily follow instructions related to the nasogastric tube insertion. So now let's proceed to the preparation. First is that we need to determine the size of the tube to be inserted or not the tube is to be placed or attached to the suction. So the rationale of that is to help us determine or accurately determine if the tube can reach the stomach, and also this provides accuracy.
Explain the procedure and develop a hand signal. This reduces the client and the patient's SO anxiety and to make them know what to do to cooperate during the procedure. And then we also need to wash our hands and don gloves after explaining it to the client. So this reduces the risk of transmission of the microorganisms. Now we need to provide client's privacy. So the rationale of that is to provide client's comfort.
So now, let's assess the client's nares. So we need to ask the client to hyperextend their neck. So ma'am, ato sumusali sa tagamay mama. Okay, so after that, using our pen light, we need to observe for the intactness of the nostrils and also for any irritations and abrasions. So the rationale of that is to help prevent irritation, and also a patent nostril will help prevent any complications and trauma. So, okay. So next is we need to examine the client's nares for any deformities and abrasions. And also we need to ask the client to blow their nose one nostril at a time. So the rationale of that is to help determine which nostril where the tube is suitable to be inserted. And the next is we need to select the nostril that has a greater airflow. So the rationale of that is that the nostril that has a greater airflow has less obstruction during the tube insertion, and also it will help to prevent discomfort and pain to the client. So examine the nares and then blow your nose. Okay, so this part, the right nostril, has a greater airflow. So now let's prepare the tube. So if you are using a rubber tube, so we need to place it on ice for 5 to 10 minutes. So the rationale of that is to prevent the tube from being curled, and also it will help the tube to be easily inserted to the nose without being curled inside. And the next is, if we are using a plastic tube, so we need to place it on a warm water. So the rationale of that is to hold the tubes, and so the rationale of that is to ensure the tube's flexibility. So now let's determine how far the tube can we insert. So first is we need to measure the distance from the tip of the nose and then to the tip of the earlobe, and then from the tip of the earlobe to the secured process of the sternum. So okay, this part. So the rationale of that is to determine the appropriate length of the nasogastric tube to be inserted. Next is we need to mark the length with an adhesive tape if the tube has no markings. But our tube here has a marking, so we don't need to put an adhesive tape. So the rationale of that is to provide us a guide to the length that we really needed, and then also to help us promote an accurate tube measurement. Then, next. Now let's proceed to don sterile gloves and start to insert the tube. But first, we need to lubricate the first 4 inches of the NG tube with a water-soluble lubricant. So the rationale of that is to help the tube to be lubricated externally with a lubricant jelly, and also we must remember to not use non-water soluble lubricant, and also this will help us to have an easy insertion to the client's nose. So we need to lubricate it with the lubricant jelly. And then next is we need to ask the client to flex their neck backward. So this will help us to have an easy way of inserting the tube to the nose. So now let's gently insert the tube with its natural curve towards the selected nostril. So the rationale of that is to follow the natural anatomical alignment of the nasopharynx. So next is ask the client to tip head forward and gently advance the tube towards the nasopharynx. So this is where usually the client starts to gug. So if the client starts to gug, we need to stop the movement. So okay, dropping the head forward closes the trachea and opens the esophagus. And then next is we need to advance the tube several inches at a time as the client swallows until the tape mark is reached. Okay, so the rationale of that is to assess the tube past the esophagus and also to ensure accurate placement. So okay, so if gag reflex is present, have the client swallow water or ice chips as the tube is advanced. So okay, sir, swallow sa taog water, sir, because the rationale of that is swallowing helps the insertion process. So while swallowing, if the tube meets resistant, we will re-lubricate it and insert the tube in the other nostril. So the rationale of that is to help prevent irritation and abrasion. And then, if respiratory distress are seen, so we need to withdraw the tube immediately. So the rationale of that is to more aggressive coughing and gagging will indicate that the tube is entered the airways of the client. So next is, after withdrawing it, we need to wash the tip or wipe the tip of the tube, and we must allow it to dry. So the rationale of that is to prevent any microbial growth. So okay, now let's secure the tube with a tape. So the rationale of this is to ensure that the tape will not be removed or displaced. And now let's proceed to check the tube correct placement. So first is we need to aspirate gastric content. So we need to So now let's check the placement of the tube. So first is that we need to assess the gastric content of the client. So what are we going to do? We need to aspirate the gastric content, and we need to assess the color and the quality of it, and we can test it by using a pH indicator strip. So if the result is 5.5 below, well, it indicates that we properly insert the tube to the stomach. But if the result is 6 above or 5.5 above, well, it indicates that we don't properly insert the tube to the stomach. So we need to immediately remove it. So now we need to aspirate. Then we test it, and the result is 5.5. So next is we're going to auscultate the epigastric region of the client. So auscultating it will help us to hear a whooshing sound. So the rationale of that, the whooshing sound indicates the proper placement of the tube. So we need to get 30 ml of air. Okay, we auscultate it, and now we're going to insert the 10 to 30 ml of air. So next is we need to prepare the client for x-ray if prescribed. So we need to ensure that the tube is in the correct placement for feeding. Is we need to attach the tip of the tube to the suction, to the drainage bag, or to the adapter according to the purposes of the nursing intervention. So the rationale of that is to provide effectiveness of care and safety. So now let's secure the tube with a tape and attach it to the client's gown or bed sheet. So the rationale of that is to ensure that there will be no tube displacement, and this will provide patients comfort. Okay, so now we were going to remove our gloves and then dispose it properly to the contaminated container. And next is we're going to wash our hands. So the rationale of that is to reduce the transmission of the microorganisms. And then we're going to provide the client to a comfortable position. So the rationale of that is to provide clients comfort. And next, we're going to document the relevant information. So the rationale of that is to promote continuity of care and for legal future reference.
Assist the client to a forward position in bed or sitting position in chair, the normal position for eating. The rationale of this is to promote client comfort, prevents aspiration of fluid into bags, and to facilitate AC tube feeding. Explain the procedure and develop a hand signal. This reduces the client and the patient's SO anxiety and to make them know what to do to cooperate during the procedure. And then we also need to wash our hands and don gloves after explaining it to the client. So this reduces the risk of transmission of the microorganisms. Now we need to provide clients privacy. So the rationale of that is to provide clients comfort. Assess the placement of the tube either by A. Aspiration of gastric content and test pH with a pH indicator strip. So the rationale of this is to ensure that the tube is in the stomach. B. Auscultation for whooshing sound in the epigastrium upon introduction of air into the tube. So the rationale of this is to ensure correct tube placement. Now, prepare the feeding. First is to check the expiration date of the feeding. So the rationale of that is to promote safety and prevent errors and harm. Next is warm feeding to a room temperature. Warm temperature or neutral room temperature promotes efficient feeding and prevents discomfort. Next is, if using an open system, clean the top of the feeding container with alcohol and rinse with clean water the syringe to be used. The rationale of that is to prevent risk of contamination and microbial engagement into the feeding syringe. Sanitize the opening of the feeding bag and hang the bag from an infusion pole about 30 centimeters or 12 inches above the tube's point of insertion to the client. So the rationale of this is that the gravity helps providing proper flow of the fluid or liquid food from the tube. Clamp the tubing and add the formula to the bag. So the rationale of this is to ensure that no formula will be wasted. Next is open the clamp and run the formula through the tubing and then re-clamp. The rationale of that is to help to run the formula to the patient and prevents inhalation of the excess air in the stomach. Attach the bag to the nasogastric or orogastric tube and regulate the drip factor, adjusting the clamp to the drop factor on the bag. So the rationale of this is to ensure accurate drip factor as prescribed. Remove the plunger from the barrel of the syringe and connect the tip of the syringe to the pinch or clamp nasogastric or orogastric tube. Pour feeding formula of the barrel to the syringe. The rationale of that is pinching prevents excess air to enter the stomach and may cause distension. So in this part, I use water as my substitute or my DIY to a liquid feeding formula. Next is permit the feeding to flow in slowly at the prescribed rate or by gravity. Raise or lower the syringe to adjust the flow as needed. So the rationale of that is to prevent errors and to ensure that the doctor's prescription is accurately applied. Next is pinch or clamp the tubing to stop the flow for a minute if the client feels discomfort. So the rationale of that is to prevent client discomfort. And next is add a clean water to clean the tube. Help the client drink water. Remove the screw-on cap from the container and attach the administration set with a drip chamber and tubing. It must be done in a sterile way to prevent contamination to the tubing. So that is the rationale. Next is close the clamp on the tubing. The rationale of that is to prevent contamination while feeding. Hang the container in an IV pool about 30 cm or 12 inches above the tube's insertion point to the client. The rationale of that is to help to ensure that enough pressure is present to keep the formula running in the NGT tube as a constant rate. Next is squeeze the drip chamber to fill it to 1/3 or 1/2 to its capacity. The rationale of that is to ensure an accurate drip count. Next is open the tube clamp, run the formula through the tubing and re-clamp the tube. The rationale of that is to make the formula run or flow to the tube to provide nutritional feeding. Next is attach the feeding set tubing to the feeding tube and regulate the drip rate to deliver the feeding over the desired length of time. Pre-filled feeding set can be attached to the feeding pump to regulate the flow. The rationale of that is to ensure accurate fluid drips from the NG tube to the client's stomach. Next is rinse the feeding tube immediately before all the formula has run through the tubing. So, we need to instill 50 to 100 ml of water to the feeding tube. The rationale of that is to prevent residues from the liquid food to clog, causing an ineffective tube feeding. So in my case, since I have a 30 cc syringe, so I need to withdraw 3 times of 30 ml of water to get 90 ml of water. And then lastly, add 10 ml to completely rinse the feeding tube with 100 ml of water. Next is be sure to add water before the feeding solution has drained from the neck of the syringe or from the tubing of an administration set. The rationale of that is to ensure that there will be no feeding solution is clogged. Next is clamp and cover the feeding tube. So the rationale of that is to prevent contamination. Next is ensure client's comfort and safety. The rationale of that is to promote safety and prevent discomfort. Next is dispose equipment properly and do aftercare. The rationale of that is to provide neatness and cleanliness, prevent transmission of microorganisms, document all relevant information. The rationale of that is for future legal reference and to have an effective continuity of care. Confirm the physician's order for tube removal. The rationale of it is to prevent errors and prevents causing harm to the patients. Next is assist the client in a high Fowler's position or to a sitting position if health permits. So the rationale of that is this position helps in removal of the tube and also prevents back pain to the nurse. Next is place the disposable pads across the client's chest. The rationale of that is the nasal or oral secretions may be evident during this procedure. Have the client hold emesis basin and a towel or tissue to wipe the nose and mouth while the tube is removed. The rationale of that is to provide cleanliness and for the client to use it in case he or she vomits. For the procedure, identify client, assess client's consciousness, and explain the procedure. So the rationale of that is to provide proper patient identification and promotes cooperation while it builds trust. Next is wash hands and don gloves. So this reduces the risk of transmission of the microorganisms. Next is prepare the environment and now provide a privacy. So this promotes client's dignity. So that was the rationale. Next is prepare the equipment. So the rationale of this is to provide smooth flow of the procedure. Disconnect the tube from any attachment. The rationale of this is to prevent risk of aspiration of the feeding tube. Next is remove the adhesive tape securing the tube to the nose and safety pin from the client's gown. So the rationale of this is this allows for the tube to be easily removed. Next is removing the tube. Pinch the tube with a glove hand. The rationale of this is to stop the flow of the food for a while. Now, ask the client to take a deep breath and hold still while pulling the tube out. Coil the tube around your hand as you are pulling. The rationale of this prevents aspiration. Holding the breath closes the gluteus. Next is remove the tube slowly but evenly over the course of 3 to 6 seconds. The rationale of this is to prevent any residual feed from flowing out of the tube upon removal. Observe the intactness of the tube. The rationale of this is to ensure that there is no left parts or particles of the injured tube inside. Next is place the tubing in a plastic bag and handled with biohazard precaution. The rationale of that is to reduce the transmission of the microorganisms and abiding the biohazard precaution promotes client and staff safety. Next is dispose the contaminated materials in a proper container, remove gloves, and wash hands. The rationale of that is to promote cleanliness and reduces the transmission of the microorganisms. Now, to ensure clients' comfort, first, provide oral hygiene. So the rationale of this is to provide clean mouth and provides clients comfort, and also to provide cleanliness and to prevent the bacteria to lodge into the patient's mouth. Next is assist the client to clean the nares. The rationale of this clears the nares passages of any remaining secretions. And lastly, document the injured tube removal, amount of drainage, and the client's responses. The rationale of that, documenting the patient's response to the removal provides future references for continuity of care. And that would be all for nasogastric tube feeding. Thank you so much and God bless us all.